All right, let's get started. Thank you all for joining this webinar today. The webinar will run probably about 45 minutes and there'll be time for questions at the end. Also, feel free to ask any questions throughout the webinar if you have a question, and I'd be happy to answer those. So this is an introduction to the Gateway to Global Aging data. And I'm going to kind of walk you through some of the data that is available for research, longitudinal data looking at retirement age populations in different countries, let you know about how to access that data, and introduce you to the web tool that we've built called the Gateway to Global Aging Data. So let's first start out with being introduced to the set of what we call HRS, or Health and Retirement Studies around the world. So starting in 1992, the HRS, the Health and Retirement Study, started in the United States. And that started in 1992. And they survey people over the age of 50 and their spouses. And it's done, like all of these surveys, almost every 2 years. And you will see as we go further that all of these surveys have similar questions because they were really designed to be harmonized. And that is to be able to compare things cross-nationally using these surveys. The next survey that was started was the Mexican Health, Aging, and Aging Study, or MHAS, which was started in 2001 and 2003. They then took a 10-year gap, which is unusual, and they've gone back and they now have Wave 3 data available, collected in 2012, and Wave 4 data coming, recently collected. England was also added in 2012, so we have data available in England through the English Longitudinal Study on Aging, or ELSA. The Survey of Health, Aging, and Retirement in Europe, SHARE, was started in 2004, and that includes over 20 European countries plus Israel. The Korean Longitudinal Study of Aging gives us data on Korea. And they focus on people aged 45 and older. So for a couple of these studies, you actually get people a little younger than 50, depending on how the study is set up itself. Petrie asks, is Lassie included? And yes, we will be getting to Lassie shortly. Lassie is the newest study to come online. The IFLS was next, which was an earlier study started in 1993, and it looks at Indonesia, the Indonesian Family Life Survey. But it became comparable with HRS in their 2007 wave. The Japanese Study of Aging and Retirement, or Jstor, started in 2007. This is the one study that is not nationally representative. All the other studies are nationally representative currently. We get a larger study now called SAGE, which is the Study on Global Aging and Adult Health, and this is conducted in multiple countries, just like SHARE was. SAGE includes China, Ghana, India, Mexico, the Russian Federation, Russia, and South Africa. And their Wave 1 sample was conducted between 2007 and 2010, and their Wave 2 sample between 2013 and 2014. The next study to come online is the Irish Longitudinal Study on Aging, or tilde. This was started in 2010. They have 2 waves of data available. Karlis was next added, which is the Costa Rican Longevity and Healthy Aging Study. And that was started since 2011. They have 4 waves of data available. The China Health and Retirement Survey, or CHARLES, was recently added, and that was started in 2011. They have 2 waves of data currently available. And Lassie, as was asked about, is a longitudinal study in aging. And we conducted a pilot study there in 2010. The baseline survey will go out hopefully during this year. And so that data will be available sometime in 2017. Lassie, we're very excited about at our center here at USC. We're one of the organizing partners for conducting the survey. And that survey is nationally representative of all of India, and it's nationally representative of every state inside of India. So there should be some really great data available for research coming out of that. All of these studies are partly funded at least in part by the National Institute of Aging, which is part of the National Institutes of Health here in the US. And so these are all available for research. And I'll talk about how you get access to these studies, but they're all freely available. Yan Yan asks, can we have access to the slides after the webinar? And absolutely, I'll be posting these on our website, and I'll show you where you can access these after the webinar. We're also recording this webinar, so you can also just watch the video if there's something that you miss later, and I will give you that link. So all of these studies, as I said, kind of have similar questions, and they focus on core content areas. And one of the things that I want to show you is that these studies focus on a lot of different research domains. So whether you're interested in health or employment or more economics or psychosocial measures or family measures, these are asked here. So we have health questions, including questions about cognition, diseases, emotion, physical functioning. They use ADLs, activities of daily living, and IADLs. Physical measures like height and weight, and health behaviors, things like drinking and smoking. They also survey respondents about health insurance, health services utilization, healthcare expenditure, out-of-pocket spending. And they have questions about labor force, whether someone is currently employed or retired or maybe partially retired. And then their employment history is also asked, often when they started their first job or when they last worked their last job before retirement. The amount that they earned, whether they're on disability, the characteristics of their work, and pensions. There's a host of economic variables, which include income, all sorts of income, wealth and consumption, earnings, government transfers, housing wealth, and financial and non-financial assets. And then there's a set of questions which are more social, and those include family structure, social network, family demographics, family exchange, so whether there's money that's being exchanged between different generations, and family support, which would be things like caregiving between different generations, and questions about marriage and social participation, things like, do you often attend social activities or religious activities? So a couple of the key innovations I'll just mention briefly are enhancing the quality of economic data. So for most of the economic questions, there's a non-response bias in that people are often unsure or they're just unlikely to actually have an estimate if you ask a question like, how much do you currently have in your investment retirement account? And so these surveys use unfolding bracket questions, which kind of get an idea. So if someone says, I don't know how much I have in my retirement account, they can say, okay, so is it more than 500? And if they say yes, they say, okay, is it more or less than 1,000? And you can kind of get a range there. This is very helpful for using economic data. And then almost all of these studies also, we also have imputations provided by these. And so these imputations fill in these missing data, which is quite helpful because it means that you don't have to drop people who did not report certain economic values if you're interested in using some economic values in your research. They've also integrated biomarkers into social surveys, and it's one of the things that makes this set of surveys very powerful. So these biomarkers include physical measures, blood measures, and genetics. So the physical measures are height and weight, waist, blood pressure, grip strength, lung function using a puff test usually, gait speed, so a timed walk, and a balance test, also sometimes a chair raise test. A few of the studies collect blood, so whole blood is collected by ELSA in England, tilde in Ireland, Charles in China, and MHAS in Mexico. And dried blood spots are collected by the HRS in the US, LASI in India, for Germany through SHARE, and in Indonesia through IFLS. And a few of the studies have not yet collected blood. And blood is helpful because you can get ideas about people's health. These are real measures of things like cholesterol. And then two of the studies currently have genetic data also available. They have both done a GWAS in the HRS in the US here. That's through a saliva sample, and an ELSA that's through a whole blood sample. And these are really powerful. So one of the, I said that you kind of pair these social questions with actual physical measures. And that's really helpful because you can really start to look at whether something is happening because of someone's genetics or something is happening because of their environment or behavioral decision they're making. And other studies are also all the time considering adding more physical measures or genetic measures or blood measures for those that don't currently have it. So you must remember that these studies are continually conducted every 2 years in general. So they're being revised and expanded a little bit every other year. So one of the things that we did here at our center is we developed a set of domain-specific user guides. So currently these are the user guides that we have available. And these user guides are helpful if there's a particular research topic you're interested in and you want to know how this question was asked in different surveys. So we have these for chronic medical conditions, financial transfers, expectations, employment and retirement, income, wealth, cognition, health behavior, and informal care. And I'll show you where you can download these. These are freely available for downloading on our website also. And then we also built this web tool, the overview, the gateway to global aging data. And the primary functions that we're going to be talking about of the gateway today are we include a digital library of survey content. We include illustrative flowcharts, which shows skip pattern inside of a survey. We have a survey concordance that allows you to intelligently search to locate relevant survey items. We have interactive graphs and charts. We have a harmonized data file for cross-country analysis. We have these for most of the studies currently. And we also built recently a searchable library of publications based on health and retirement surveys. So let's quickly, I'll take you to the website. If I can get this on the screen there. There we go. So the website is available at g2aging.org. This is our landing page. And then we can go home and kind of drill down. And you can see here at the top, kind of we have the main features of the website here at the top. So we're going to kind of be walking through these and giving you an idea of how you can access all these wonderful data resources that are available. So let's talk about survey metadata. So I mentioned that we include a library of survey content. And what I mean by that is survey metadata. So metadata provide detailed information about all parts of the survey without providing the actual survey microdata. And when I say microdata, I mean that would be the data set that you would download, which would give you the respondents' answers to the question. When I say metadata, metadata include the location of all survey items, so survey questions, inside of the survey. This includes question texts, whether there were interviewer prompts, answer types and choices, how the question was asked and to whom, links to the microdata variables and how those values are formatted. So in this question that we're looking up through metadata, this question information, where is it stored inside of the data set and how are they formatted? How is a yes formatted and how is a no formatted? We also have assigned research topics, keywords, and domains for faster searching, and we suggest similar survey items. So let's look at some of the survey metadata. If you use the Surveys at a Glance tab here at the top, one of the things you can see is we have this chart here with the core interviews, and that being kind of the main interview that is asked. And this chart is helpful because it gives you an idea, as I kind of did in the intro, about when different surveys came online. So you can see the HRS started in 1992, but SHARE here, the European survey, started in 2004. And this is also helpful because you might have heard me say WAVE. So a WAVE refers to the baseline is usually considered wave 1, which is the first year of the survey, the first time the survey goes out. And then wave 2 would be usually 2 years later when the survey is done again. That's considered wave 2. But wave 1 of SHARE is not conducted at the same time as wave 1 of the HRS. So this chart is helpful if you want to compare things that are in the same year across the globe. It's helpful to use this chart. So for instance, if we're looking at interested in looking at 2012, we would want to use HRS wave 11 for the United States, MHAS wave 3 for Mexico, and ELSA wave 6 for England, and so on and so on. We also, I'll just mention this, we also have kind of a study overview. tab, and this just gives you some really basic information about the surveys, including if you've forgotten where each survey was conducted, where it has data on the age eligibility, which, as I mentioned, changed a little bit. So in Korea, in the Korean study, the Chinese study, and the Indian study, it starts at 45, and most other countries it starts at 50. Whether spouses were eligible and included, and then how the survey was conducted, whether in person or self-completion or on the phone. But let's go ahead and look inside of some of this to really drill down to the survey metadata. So let's go into share wave 2. So that is for the European survey, the 2006 survey. So the first thing you can see here is a list of survey modules. And modules are just different parts of the survey which are usually related to particular content areas. So you can see we have a couple of cover screen modules, which usually just kind of get an idea of what's going on at the household and who you're speaking to as the respondent. And then you have questions about demographics, physical health, behavioral risks, and so on. So let's go into this behavioral risk module. And here we get the items that are included in this. You can see we have a type here through this icon here. And you can see that a couple of these are just ID variables. And then we get down to our questions. So our first question is labeled BR001, that's behavioral risk, question 1. And the question is, ever smoked daily? And we can click into that for more information. And this gives you kind of the baseline of the metadata that we have available. So the question is, ever smoked daily? And the question text is, the following questions are about smoking and drinking alcoholic beverages. Have you ever smoked cigarettes, cigars, cigarillos, or a pipe for a period of at least 1 year? We let you know that the answer type is enumerated as opposed to a continuous value or a categorical value or as like a short answer value, a string answer. And the answer choices are yes and no. We also let you know that inside of the shared data, a yes is coded as a 1 and a no is coded as a 5. We let you know this item is used in a harmonized survey, which we're going to talk about later on. And we also have this associated variable. So if you have the shared data set, and we'll talk about how to get access to that shared data set, you could find the microdata that correspond to this question in the variable BR001 underscore. You can locate it in a flowchart, and we have a couple of topics assigned. We also highlight concurrent items. So this is the same question that's asked at different waves. And then we also have some researchers we're also interested in, which is a bit of cart matching. And it looks like someone has been using the site and is looking at smoking and I guess possibly also related to self-rated reading skills. So kind of one way is to go through the survey as we did if you're familiar with the survey and go through the particular wave of your interest and the module of your interest to the survey items. But usually, especially if you want to search multiple surveys, it's a lot of legwork. So we also built a survey concordance for easy searching. So users can identify comparable survey measures between all health and retirement surveys, and you can use a keyword search, top-level research domains, or finer research topics for harmonized studies. And these harmonized studies are data sets that we produce here in collaboration with the studies to kind of provide a very user-friendly data set which has those most harmonizable variables included, and they're all coded in the same way. And we'll talk more about that. So the survey concordance allows users to find comparable measures between multiple waves of one study and the same year in multiple studies. Let's see. Marjolaine Iverson asks, are there separate questions on receiving home care? So that's a great question. And let's use our survey concordance to do that, to search for that. So I'm going to jump back to our website, and I'm going to click on the concordance tab. So you can see here we have kind of a search box, and I mentioned one way was to search just by keyword. So let's search for home care here, and let's look for interested, maybe let's just say HRS. You can select which year the HRS. Also, if you wanted to select a different study, let's say ELSA, as soon as you selected ELSA, you would see that the years that ELSA is available would come online like this. So let's say if we're, let's say ELSA 2002, 2004, 2006 waves. Let's search for home care. And see, we don't get anything there. Let's try for the same years in the HRS. I'm not getting anything there, and this could be, I wouldn't say that there isn't home care. Home care isn't asked in these. I think it actually is, but it's often maybe called, let's try informal care. Yeah, so here's a lot of questions about informal care that are asked inside of the HRS. And I think there are questions asking about where some of this care is given, whether in the home or not. So it might take a couple of different variables to be able to get whether the care was in the home or not, but you should be able to find that. Let's go through a couple more examples with the concordance tab. So for instance, we could search for, say, height in Charles. Again, we would see we have Charles. Let's search for Charles 2000. Let's look at the newest data, Charles, the newest survey, Charles 2012. We can look at their wave 1 here. So you can see that here we have height. We have a couple different questions about height in the description. We have knee height, looks like maybe a regular height, and then some questions about maybe like why didn't complete here at the end. And for any of these, we could jump into the module level, so at the biomarker level, or go into the item. So for knee height, let's just go into it. We can see the question text is, next I will measure your knee height. Please sit on a chair with a bare foot. And then do you agree and understand the directions? And so this is just whether this variable categorizes just whether they list these directions or not, whether they understand the directions or not. So going back to our concordance, let's also look at some examples using, you can see here underneath the keyword search, we have a lot of different topics. So for instance, we could search for, let's say if you wanted to be more general, let's say if you were interested in ELSA in their 2006 wave, their wave 3, and you were just interested in family and social network questions. We could scroll down and search through that. And you can see that we get a lot of questions here in their self-completion questionnaire about family. And these are more general questions. So at an original survey data question, survey level question, the topics are more broad, something just like family. But for instance, if we were going to use some of our harmonized data, we could instead select something like number of children and look for that in the harmonized ELSA for the same year. And if we search for that, then we should be able to find the exact variable. And here we go. The variable is titled H3 child that was asked in the harmonized ELSA. And we can see that it's the number of living children. So for these harmonized variables, you can really drill down using the concordance search to find the exact variable that you're interested in. Let's do one more example. Let's look for health in general. And let's look for that in Share, our European study. And we'll do their wave 1. Let's make sure, yeah, we've clicked out of family there. Okay, so it looks like, so we've got health in general, and it looks like we've got a couple health in general questions here. So we've got PH002, PH003, PH052, PH053. So one thing that we can do is we could just click on these, but we could also just click on each individually, or we could click on the module level. So let's go into the module level. So here we have the physical health module of Share Wave 1, and you can see here are all the questions that are asked. And you can see here we have some health in general questions at the end of the survey and some at the beginning. But let's look at our flowchart view. I mentioned that we have built flowcharts for all of these. And flowcharts are a really helpful way to look at survey skip patterns. And with all of these surveys, there's survey skip pattern, and it's really important to be able to look at survey skip pattern and understand this. So let's see. So we're going to start the physical health module. This is a visual representation of what the survey logic is saying. So the first thing that happens is you get a random number that's generated. And it looks like that's either a 1 or something else, maybe, so like a 0 or a 5. And if you get a 1, the first question you get is, how would you say your health is? And it's a scale of very good to very bad. If you didn't get a 1, then you get this question, which is version 2, which is how would you say your health is? Excellent to poor. And one of the things that Jstor is doing here is that they want to test the difference between these two different scales. These are two scales that are used for self-reported health. The first one, which is very good to very bad, is often called the European scale or the World Health Organization scale. And the second one is a US-based scale. You notice the US-based scale is kind of a little more tilted towards feeling good, right? There's 3 levels of it essentially feeling good about your health. So one of the things Jstor is looking at is how do these relate to each other. And then if we scroll through, so you can see that we have the whole survey, and you can see the survey skip patterns. And it's really important to account for skip patterns if you're doing your own analysis, because say you're interested in using this question, say, which is, would you say that the help you receive meets your needs? So all the time, usually, some of the times, or hardly ever. But this question was only asked if people said that they had these needs, right, previously. So you want to make sure that you've accounted for people who didn't have those needs at all, so those people can still be included in your research. And if we scroll down, it looks like we get our second set of 2 health and general questions. So it looks like if you didn't get a 1 to begin with and you had a 2, that was the other value, then you get asked this question, which was the second one, the US version of self-reported health, instead of the European version, and the people who were first asked the US version get asked the European version. And so Jstor is also testing something else here too, which is where is this question asked inside of the health survey, and does that matter? Because one of the things that you'll find inside of surveys is that if you ask people how their health is in general, they answer differently if they're answering that question, whether before you ask them kind of about all their other health problems versus after. So once you've gone through and said, can you tell me everything that's gone wrong with your health in the last 2 years, they will often answer this health in general question quite differently than just have asked out of the blue. So I like this example because it gives you a real nice idea using this flowchart of why it's important to understand survey logic and how these flowcharts can help you kind of explain things. We have a question from Yan, which is what is the difference between types? For example, Q and C and ID. So if we look at the module items page here, so here we have ID, and this is just an identifier that's used inside of this module to identify the person or the country or the wave, in this case the language that Jstor was asked. And then we have this CO, which is our random variable, the random number that was generated. And this is a constructed variable. It's constructed at the time of the survey, so that information is recorded. And then Q is for question. So question is the question that was asked. These are the real survey questions. All right, so let's look at, we'll look at one more example of a flowchart. And this is from the Behaviorists module also, and this is a question about ever smoked daily. So you can see first if someone is asked whether they ever smoke daily, if they say yes, then they get asked do you smoke at the present time. And if they say no, then they could skip that question because it would be repetitive to ask the question to a respondent. And these surveys are expensive to conduct, and you really want to be respectful of the time of their respondent, who often sit for hours through these interviews. So skip patterns are used as a way to not ask unnecessary questions to respondents. We've also built interactive graphs and charts. And the interactive graphs and charts are a really nice way to get to kind of play around with the data before you have access to the data itself. And we'll talk about next how to get access to that data. So if we click on graphs and tables here on our top, you can see the first thing we get is this chart, which is currently working for pay in the United States and China. And we have it just for the year 2010. So it looks like in China we have working for pay is 63% of the population, and the US is 46%. But for instance, it might be more interesting to look at this we remember one of the differences about Charles is that Charles starts at 45, and the HRS for the US starts at 51. So some of this difference we could just be seeing is in the populations. let's look at a couple other examples. Let's generate some charts ourselves. So let's say we want to look at, let's see, the United States, England, Japan, and from share here, we could look at also Italy. We could look at the year 2006. And let's look at smoking rates. So we can click down here, and you can see we have a lot of measures that you can currently graph, grouped by research domain. So smoking would be here in the health box. So let's say ever smokes. All right. And you can also filter by age or gender. In this case, let's just leave this. So let's click go. If this is the first time that the chart has been generated, it'll take up to 60 seconds to kind of process it. Once a chart has been generated at least one time, then it's quite quick to generate this chart, and it doesn't take much time at all. So while this is generating, let's look at a couple other examples. So this is a chart which is currently working for pay, and in this case, we've kind of sub-selected. We use our filter feature to say only for people aged 55 to 64, and we've looked at a host of more countries instead of just China and the U.S. And so one of the things that you see first is that if you look between China and the U.S., in the same age range of 55 to 64, you can see that the U.S. actually has a higher currently working for pay population. You can also see that Sweden here has the highest, more than 75%. And England is right on par with the U.S. Japan is a little higher, but not quite as high as Sweden. And you see a country like Slovenia has a really low, a really low number for this. And this kind of gives you an example of why these surveys are so powerful, because you have a lot of different types of countries that are included here with very different populations and governments and traditions. So you can really see some of these differences and exploit some of these differences to answer research questions. Here's also a graph of total family income for England. This is in 2004. And here we've said, give us 3 different age groups. So going back to our page, if you select just one country, then you can also say compare across subpopulations. So in this case, we said filter by age and year of the survey. So we've done by 3 different age groups: age 55 to 64, 65 to 74, 75 to 84. And so what you can see is that total family income really changes. The distribution really changes between different ages, which would make sense as more people are moving from an employment-based retirement at early ages, maybe towards more of a pension or a pension-based retirement or savings-based retirement later in life. And we also allow you, including the graphs, you can look at a graph or a table. So here's a table that looks at net value of primary residence, and this looks over a set of years. So it looks from just for the United States between 2000 and 2010. And one of the things you can see here is that house prices, looking at both the median and the mean, really continued to rise. 2000, 2012, 2004, 2006. 2008, they kind of dip or hold steady a little bit. And then by 2010, they've really gone down to levels pre-2012 for sure, which is really interesting. And it shows you kind of here, you can, because this is national representative data, you can really see the effect that the housing crisis had here on the retirement age population here in the U.S. One of the nice things about all these graphs and tables is that these are already all weighted, and the survey design is already accounted for. And in this case, we've already, because we're looking over different years, all these financials have been adjusted for inflation and are shown in 2010 currency. So we've taken a lot of the legwork out. Now, as you recall, this list here doesn't include everything. There's certainly a lot more measures that you could look at in these studies, but we wanted to give you kind of a few of these measures to look at across different studies and be able to play with the data to see how it works. Again, here you can click on table and you can see table. Tables can be downloaded in CSV or PDF format, and graphs can be downloaded in a couple different image formats. As long as you cite us, you're welcome to use those. So let's talk about registering. So everything that I've shown you so far in the presentation, you don't have to register to your website, but we would appreciate if you registered. And the things that we're going to be talking about through here out do require you to have register. So registration is really simple. To register, you can visit g2aging.org here on our website. Here I can if I log out of my profile here, you can see what will be replaced at the top is a register button. And if I click on that register button, then I can easily register. You can enter your information, and all that we ask is you'll get a confirmation email, and you can confirm that email. So one of the things that registering allows you to do is to use our downloads page. Let's go to our downloads page here. So on our downloads page, we first give you links to all the original data. So one of the things that we don't do here at the Gateway to Global Aging website is that we don't distribute the microdata ourselves. So we ask that you go to the surveys themselves to get this microdata. And that's important because the microdata, here we go, yeah. So that's important. So we have links here to download survey data here. So for instance, for the HRS data, you would go to the University of Michigan. For the tilde data, you'd go to the Irish Social Science Data Archive. For the ELSA data, you'd go to the UK Data Archive. And that's because all of these surveys require that you kind of sign up for their own agreements, and you have to agree to a set of terms. Again, they're all free to use, but they do want to know who you are and what you're using your research for. And usually you're agreeing that it's for academic purposes and not for commercial purposes. You can also download harmonized data sets here, and we're going to talk about those next. Harmonized dataset codebooks. And then here I just also want to highlight, here we have the working papers so that I mentioned before. So here are all the working papers, chronic conditions, financial transfers, expectations. You can download any of these here. And then we also have a recent presentations box here at the end, and this is where I'll be adding the slides for this site for this webinar today, after the webinar. So you can check back if you'd like to download the slides for this year. So let's talk about harmonized data files and what I mean by that. So harmonized data sets are created to provide harmonized measures of international aging and retirement studies. Harmonized data sets define variables as similarly as possible to the RAND-HRS definition of a variable. So if you're unfamiliar with the RAND-HRS is a version of the HRS data, and it's the version which is used by most people who use the HRS data because it's very user-friendly, it's available in one data set, and it's taken care of a lot of kind of the pre-programming work of understanding the data. So it's accounted for things like skip pattern already. So some of the hallmarks of the RAND-HRS data, and likewise all our harmonized data files, are the data sets are structured in FAT format, where every individual is one record. The RAND-HRS uses very simple variable names. So a variable like R1 work, that variable name records whether the respondent is currently working in wave 1. So R for respondent, 1 for wave 1, and work for whether currently working. And the variable names in harmonized data sets will also indicate how similar to the RAND-HRS definition of a variable the variable is. So for instance, let's say you were using the MHAS data, and the question about whether currently working in wave 1 is asked kind of significantly different in the MHAS survey, then we would still create a variable for that, but we would change the variable name from R1 work to R1 work underscore M, just to indicate that that is an MHAS specific variable and shouldn't be applied exactly as an exactly harmonizable or an exact corollary to the RAND-HRS version. We have lots of documentation that's provided to you about why this is, and we'll look at that. Also, one of the hallmarks of the RAND-HRS is that spouse versions are included. So even though both respondents and spouses are answered, because it's in FAT format where every individual is one record, so we have all the different years the respondent answered in that one record, but we also have all the respondent spouses' answers from all of those years. So we've already done some of that spouse matching if you're interested in looking at kind of family effects. So we have spouse variables which start with an S, and a variable like S2 work is whether the respondent spouse is currently working in wave 2. So here's the list of currently available harmonized data files. We have the harmonized ELSA, which incorporates the first 6 waves of ELSA, 2002 to 2012. The harmonized share, which creates the first through the 5th wave of share, excluding their 3rd wave, which was a life history, not a core interview wave. Harmonized Jstor for Japan, that's 3 waves of Jstor. Harmonized CLOSA for Korea, that's 4 waves of Korean data. Harmonized LASSI, which is the pilot data of LASSI. The harmonized Charles, which is the first 2 waves of Charles with Chinese data. And we're also currently in the process of working on the harmonized MHAS for Mexico, the harmonized karlis for Costa Rica, and the harmonized tilde for Ireland. And these should be available, these should all be finished by the end of around August of this year, and those will be available also if you're interested in looking at those countries. So harmonized data files are either distributed through the gateway or through the originating study. In some cases, the data files are created by the user based on the code provided by the gateway. So let's jump back to our downloads page, and you can kind of see the options. So you can download harmonized dataset. For instance, the harmonized ELSA is distributed through the UK data service also. So you can click on, once you download the ELSA data, you automatically have the harmonized ELSA data. But for a study like SHARE, where we have this C Stata code below, what it means is we're going to give you one long Stata program that's already programmed, and all you have to do is just edit 2 lines of the data to say where you've stored the SHARE data once you've downloaded it and where you'd like to store the harmonized SHARE data. And then you can run this Stata program once, and it might take, I think in the case of the harmonized SHARE, it takes something like maybe 10 minutes to run. But once you've run that once in Stata, you can then use that data set without ever using the Stata code again. And also, if you'd like to analyze it not using Stata, you could then convert. We have some information here about how you can convert to other packages, for instance, SAS or SPSS. And then we also provide code books here. You can download the code books here, and we really suggest that you use the code books to understand exactly how these variables were created. And let's talk about how these variables are created. So here's an example of a simple harmonized variable. So for instance, let's say we're making a measure, a variable, which records whether the respondent at wave 1 smokes in SHARE. Here's how the questions are asked. We looked at this earlier for smoking in SHARE. So first, the question of ever smoke daily, yes or no. And then if you say yes, you could ask the question of smoke at the present time. So one of the things that we've done here is we've accounted for the skip pattern. This is a really simple example. So all that happens here is we just account for the skip pattern. And one of the nice things about using harmonized data is that all harmonized data, the values are always recorded the same way. So a 0 is always a no, and a 1 is always a yes. And all of those categorical values will always be the same between different surveys. And so it makes it quite easily, for instance, to look at a smoking rate and SHARE now with, say, with the HRS using the RAIN HRS data, because they're coded exactly the same. And just for the sake of making a point here, I'll also show you an example of a complex harmonized variable. So let's say that we're interested in household wealth for Japan, and so we want a variable of their savings wealth. So here on the left are how the questions are asked about savings inside of Jstor, and then there's a lot of skip patterns that have to be accounted for in 2 different surveys. And then you can also see here at the bottom right of the self-completion panel, you can see that there's brackets which ask whether it's above or below a level if they reported that they did have savings but they didn't know the amount. And so we've also imputed variables here, and we included an imputation flag. So this is a good amount of programming that was done to create this, just this household savings. This was done in partnership with the Jstor team for you all to be able to use on our website. And household savings is just one part of a total household asset portfolio, total household wealth. And so there's really months of programming behind programming something like total household wealth. And that's all kind of done for you. One of the nice things is to say you're not an economist and you're not interested in exactly things about wealth, but say you're interested in looking about times that people make retirement decisions. You're more interested in the labor force decisions. But you know that people's wealth might have an effect on that, how much they've been able to acquire in housing wealth, their savings wealth, their pension wealth. So you can go ahead and include this variable as a covariate in your analysis without programming this all yourself. So harmonized codebooks. We provide documentation for everything that we do. So each harmonized data set is accompanied by its own codebook. The codebook includes a brief overview of statistics for each variable. It details variable creation and any assumptions made in the creation. It highlights any differences between the harmonized variable and other harmonized variables if it was created differently, a different survey. And it lists all the variables from the originating data set used in the creation of the variable. Let's look at an example of this. So this is from Sjtor. This is our smoking variables that we looked at in our simple example. So you can see we have two smoking variables. One is smoke ever and one is smoke now. And we have this at both the respondent level and the spouse level. And we have this, in this case, we have, we're just showing here, wave 1, 2, and 4 of Sjtor. We include some brief descriptive statistics. I just want to mention these are not population statistics because we haven't accounted for the weights, and weights are also always included. But these just give you an idea of how the data is distributed inside of the data set. Because it's a categorical variable, we'll tell you the codes they are and give you just an idea about the frequencies. You can see that we also use special missing values, which are available in SAS and Stata. So you can see we use .d if the person said don't know and .r if they refuse to answer. We include a lot of how constructed text. So we say RW smoke ev indicates whether the respondent ever reports having smoked daily for a period of at least 1 year. The answer to the respondent's first ever smoke daily question is carried forward in subsequent waves. And we give you a lot more information here. We'll highlight any cross-wave differences. So if this question changed between different waves of Sjtor, we'll tell you that here. And then we highlight differences with the RAIN HRS, which we kind of use as our baseline for comparing between harmonized studies. So one of the things we mention here is that in the Sjtor, respondents are asked whether they've ever smoked daily for a period of at least 1 year. In the HRS, respondents are asked whether they've ever smoked regardless of whether the smoking was daily and not given a definitive period. So depending on what you're looking at, whether you're interested in something like a risk-taking behavior, which might be captured by whether you've smoked at any time versus how much long-term exposure you've had to smoking, they're captured differently. So that's something you really want to be aware of, and we really try to highlight those differences for you. And the last thing we do is we list the Sjtor variables used. So these are kind of the base variables that were used in case you wanted to create these variables create your own variable in a different way. We'll send you back to the original data. We'll let you know what variable names were used. And again, we've explained how they were used above. Here's an example from Jstor, from our complicated example, just to show you. So here we have the value. First we have, for each wave of Jstor, the 3 waves, we have household savings. The first set of variables there are the value variables, and the second set are the flag variables. And so those flag variables indicate whether the value was reported or whether it was imputed. And this can be helpful because if you would say you want to account for something being imputed or you don't want to use imputed values, or in the case of Jstor, you need to identify top-coded values. So top-coded values were used in Jstor. So you can do that here using the flag variables. We have a lot of how constructed text, again, because this was a complicated variable to create. And then we list all the original data, the original variables used from Jstor in case you wanted to create it differently, or if you just wanted a starting point for, so where are all the Jstor questions that ask about housing wealth? So the last thing I'll briefly mention as we wrap up is our newest feature, which is our literature search. So say you're interested in a topic and you now know that you have some data available, you know how you can get access to that data, you know you can use a harmonized data set to kind of easily compare measures. I will say also that not all survey measures are included in a harmonized data set. What the harmonized data sets really focus on are those survey measures which are asked most similarly between different studies and are most often used for research. I know, for instance, I was working with a user a little while ago who was looking at volunteerism, and they wanted to know whether we had volunteerism in the question. And that isn't a question that we have. It is asked in many surveys, but it's not something that's in the harmonized data set. because not enough people have asked for it. If more people are interested, please let me know. We'll be happy to add it. But one of the things that this user was able to do is that they were then able to use all these other variables that they wanted to account for, like income and employment status, marital status, other social questions which were included in the harmonized data, gender, for instance, and age, and they didn't have to create those on their own. They could really just go, you could always combine the harmonized data with the original data if there's something that you're interested in the original data, not in the harmonized data set. So let's say you've gotten all that together, but you don't know what other papers are out there to look at things. So we built a literature search. You can go to the literature search using the publications tab here at the top right. It's our last tab. And so this is a relatively up-to-date. We're in the process of adding all 2005 publications that we can find, which are based on data from these surveys. So one of the things you can first see here is this box which highlights data. So for instance, let's say we're interested in data from tilde, like studies that use tilde data. You can see here are a bunch of papers that have used data directly from tilde, the Irish data. You could also say, for instance, maybe I'm looking for the English data. So you can search that way, or you can search both. Let's select all again. You can also search by title. So let's just say maybe we were interested in searching for caregiving. So you can search titles that way. We get a lot of papers here about caregiving. For all of these papers, we have a link when it's available directly to that paper. So here's the direct link to that paper. We also give you an alternate link of using Google Scholar. Google Scholar is helpful because sometimes if you're inside of a university or institution, it'll go ahead and allow you to access that paper without signing up. And we give you just some more biographical information about this. You can also search by author. For instance, I'm going to search for Eileen Crimmins here, who's here at USC with us. You can see a lot of papers that she's written here using HRS, ELSA, Lassie, MHAS data. You can search by source, by year, or by topic. So for instance, let's say we're interested in looking at cognition. We can say cognition papers using shared data. So here we have a lot of papers which look at cognition and shared data. You could select any multiple of these. And down at the bottom, we allow you to export these. And you can export them using text, CSV, or EndNote file. Let's see, we have another question. What venue do researchers present the work in the work on harmonized aging data? As far as the venue, maybe PT, you can kind of give me an idea more of what you mean. Are you asking whether there's a specific a particular conference? So I know that our harmonized data has been used at a lot of different conferences. I don't think that there's not one in particular, not a large-scale conference that uses harmonized data. But usually it's more of a a particular scientific area, something like maybe a gerontology conference if you're studying something about end of life, or an economic conference if you're studying the economic variables. And there's a lot of power in studying things cross-nationally, which isn't available in a lot of other data. So we know that things have been presented at other conferences. And maybe in the future we will be having a conference just presenting work on harmonized aging data. So that kind of wraps up everything, all the tools that we built here at the Gateway. We also have a help desk. So this is honestly one of the more valuable things that we do is we have this help desk, which you can email us at any time at help@g2aging.org, and we will always try to respond to you within about 24 hours to answer your question. And this could be a question about, hey, I'm having trouble using the website, to, I'm interested in using a harmonized version of, in these studies are looking at this. Can you help me know what's available in these surveys or harmonized data sets, or how to get access to the data? And we help. We have a team here, a team of researchers and programmers who work full-time on this project. So we love to be able to answer you and kind of support those people who are using the website. All right. Well, thank you guys for joining us. I'm going to stay and I'll continue to ask questions. I see there's a couple more questions right now.